or unusual.
I'll be presenting a topic on clinical spectrum of first episode of optic neuritis in tertiary care hospital in South India. Introduction. Optic neuritis is an inflammatory condition of the optic nerve which is characterized by unilateral subacute vision loss without systemic or neurological symptoms. So female gender around 14 to 45 years is 3 times more predisposed than male. Optic nerve inflammation showed various presentations such as papillitis with edematous optic disc, retrobulbar optic neuritis featuring a normal fundus, neuroretinitis which is characterized by optic disc edema with macular star. So aims and objectives. My aim is to determine the demographic and clinical pattern of optic neuritis in patients presenting to tertiary healthcare hospital, and to study the incidence of multiple sclerosis, treatment outcome and prognosis. Materials and method. Study here is a retrospective analysis where details of ocular examination were retrieved from medical records of ophthalmology and neuromedicine department services for a period of March 2013 to 21, and they were statistically analyzed. So the procedure here was the patients were clinically diagnosed with optic neuritis based on the presenting symptoms, and clinical examination comprising of visual acuity and RAPD, color vision and fundus examination were included. Patients with evidence of hereditary, vascular or toxic metabolic infiltrative or compressive optic neuropathy were excluded in the study. MRI with contrast were performed in all patients to detect the demyelinating disorder. So the statistical analysis used here is SPSS software. An independent t-test was used to detect the correlation between the age and the gender. P-value of less than 0.05 were considered statistically significant. So the results of my study here is 354 patients were records were retrieved, and out of which 151 were males and 203 were females. The average mean age was about 40.25, and the male and female ratio was about 42.5 and 40.2 respectively in male and female. So the results were characterized based on the age as 25, less than 25, 26, and more than 60. So these were my examination findings, where in my study I included the laterality, right and left of the patients, and left were found predominantly high, and visual acuity was considered, and visual acuity at presentation and after therapy was calculated, out of which vision less than 3/60 was comparatively higher side of 170, and color vision was defective in all my patients. Painful eye movement was predominantly present in all my cases, but it was absent in about 144 cases, and painful vision loss was present in about 27 patients. So the RAPD was noted in all my patients, with optic disc blurring was noted in 242 patients. Vision post steroid therapy, there was significant improvement after steroid therapy with vision of 6/9 in majority of the patient, about 177 patients, and MRI lesions was present in 33 patients comparatively. Family history here had a few relevance of which is noted in 13 patients. So this is my MRI imaging of the patient with T2 weighted flare images showing multiple hyperintense lesion predominantly in white matter, callosal and pericallosal region in frontal, parietal and temporal lobes. Other image of MRI T2 flare image showing multiple hyperintense lesion noted specified here, suggesting of periventricular demyelinating plaques which is perpendicular to the body of lateral ventricle and suggestive of Dawson fingers, which is a characteristic feature of multiple sclerosis. So the discussion. Optic neuritis is described as a primary inflammation of the optic nerve associated with a variety of systemic disorders, acute demyelinating optic neuritis being the most common form. About 15 to 20% of the patients with MS of optic neuritis presented with optic neuritis in initial presentation, and 50% developed optic neuritis during the course. So optic neuritis usually affects healthy young adults between 20 to 45 years of age. Female to male ratio of about 3:1. Age of presentation, female predilection were noted in the study was similar to the other studies. In our patients, especially retrobulbar optic neuritis was noted in 157 patients, which is about 44.4%, and neuroretinitis was noted in about 24%, and papillitis disc edema was noted in 31%, which correlates well in accordance to an Indian population. Typical optic neuritis was presented with acute unilateral inflammatory demyelinating condition with characteristic MRI findings. Atypical optic neuritis may be bilateral with systemic involvement. Atypical features include lack of pain, bilaterality, lack of response to treatment, optic nerve head hemorrhages, cotton bull spots, and with relapse upon tapering steroids. About 98.1% had unilateral optic neuritis, which parallels with Indian study. Left eye and right eye was more in compared to other studies. MRI is a valuable predictive tool detecting patients with high risk of multiple sclerosis. A potential use of immunomodulatory therapy requires a multidisciplinary approach, collaborating ophthalmology and neurological service. The dramatic improvement was noted as per optic neuritis treatment trial, and MRI revealed demyelinating lesions noted of MS in 33 patients. The risk of developing MS in optic neuritis was noted 3 times higher in women with positive lesion on the baseline MRI compared with those with absent findings on the imaging. So, conclusion, the clinical profile of optic neuritis in our patient was in accordance with multiple studies in Asian subcontinent. This study describes exclusively on incidence of laterality which lacks in other major studies. The likelihood of developing acute optic neuritis in patients with multiple sclerosis needs to be considered and dealt prudently. A judicial reference to an ophthalmologist helps in early diagnosis of underlying etiology and effective treatment. Here, these are my references. Thank you.
So, you didn't do any serological test for these patients?
Sir, serological, since it was a retrospective study, sir, we couldn't retrieve all the serological data, sir. So, we couldn't segregate or rule out with MS very specifically. So,
these were the patients in what time frame?
Sir, this was from March 2013 to 21, sir. So, it was all in MRD records. And since the patients were referred from neuromedicine services, we couldn't retrieve much data. Only with the MRI findings we could retrieve, sir.
All right.
Since you spoke about laterality, you never had any case which was bilateral, which had bilateral involvement?
Ma'am, yes, ma'am. We had
kept on highlighting the same thing throughout the study.
Since this was a study which was from the records, ma'am, all the studies which we could retrieve were more of unilateral cases, ma'am. But there are few cases with bilateral presentation, ma'am. During the COVID period, there is more of bilateral presentation.
So it is not a part of your study?
No, ma'am. This during that time frame, we couldn't come across the bilateral presentation.
Did you make a note of age at presentation? The time of presentation, age of onset to age of the time before the onset, because
yes, ma'am, these were
all of them recovered, and your main visual category was less than 3/60 was a predominant category, yes, of your vision drop pre, and yes, post treatment more than 6/9 was, yes, what you showed. Yes, so what was the time frame of your onset? Did all of the patients present very early
acutely?
And it started?
Yes, ma'am. All the patients which we retrieved were all acute presentation. They present with a sudden loss or they're...
No, how long after the onset of the symptom that they presented to you? Did you notice that? Did you take a look at that? That might be an important factor as well.
Okay, sir. I'll...